Welcome back, everybody, to another episode of the Development Project. Today, we have another guest with us. His name's Chad Nowlin. He's a doctor of physical therapy and a CrossFitter and strength athlete. And we invited him along just to talk about, how physical therapy fits into the world of athletics, especially in people who do functional fitness, and how important that is for us to be able to have people that understand movement from that capacity to keep us moving and keep us doing the things that we really want to do. So, Chad, thanks for joining us. Why don't you fill us in a little bit about who you are and give us some of your background?
Yeah, so Dr. Chad, I own my own practice, NRG Physiotherapy. That was really born out of my background in outpatient orthopedic physical therapy on the corporate side. So I was very high volume, insurance based for a long time. And ultimately, the grind of that is what pushed me out into my own practice. That deep need for specifically the athletic population, there was just a large gap of what you can give somebody in an insurance network versus what they really needed to return to whatever it is that they need. This could be grandma out gardening every day, or it could be high-level athletes, CrossFit athletes, Olympic lifters. So really, that's what gave me the big push. My educational background, kind of standard deal. You know the drill. DPT out of Harding University. Did my time there. Had a lot of good clinical rotations where I was able to start kind of getting my feet wet, testing some of these concepts out for movement and physical therapy. And as you know, that's an entry-level DPT. They teach you just enough to not hurt people, on accident anyway. And that's kind of where I started. I started very similar to most PTs coming out. I already had an idea of where I wanted to go, what I wanted to be doing, the type of person I thrived with really well. And that's kind of what led me to the clinics I chose. So outpatient orthopedics was a natural selection. My first clinic was a high-volume Medicare clinic, so not getting to see a lot of my ideal client until we picked up a contract with the local university. And that was really my first big push into athletes. We saw all post-surgical athletes at that clinic from the university. And then moving to Indiana, that was in Texas, I landed at Athletico. And that's where I was pretty high volume, got to see a lot of patients. Not all bad. It's not all bad to be high volume. That fits with a very that setting is great for a certain population, just like what I do now is great for a certain population. So I can get pretty wound up talking about it. It's not all bad. Mm-hmm. There are some great things about that setting, particularly for a clinician standpoint, a new DPT coming in standpoint. There's a lot of value in being able to learn a lot because they provide great educational opportunities, and there's a lot of value in seeing a lot of people because you get to learn a lot just from treating people. So that's kind of my basic background, just education, where I've worked, and it's been fun. Everything I've done so far has been a lot of fun.
Awesome. Give us a little bit about your athletic background. What do you do for fitness? How do you keep yourself fit?
Yeah, so I was a big ball player, loved basketball. I still do, but I don't get to play as much as I'd like. So from a sports standpoint, golf and basketball pretty much were my passions. After starting business, both of those have trailed off pretty significantly. So now I live mostly in the strength and conditioning fitness world. I do CrossFit in the basement. It's where I'm working out most of the time, a couple days a week. I did do CrossFit for a while. I don't know how long. It was long enough that I can't count. I did that for a long time until my schedule wouldn't allow. My goals kind of changed a little bit for my own lifestyle and what I was after, and the gym I was training at didn't fit my goals. And that was another push. I was just moving into something different. I'll probably cycle back eventually. But I'm a big believer in strength. I'm a big believer in CrossFit. I'm a big believer that everybody can do CrossFit. I'm almost to the point where I think everybody should do CrossFit, just because it's scalable, it's functional, and really that's what life is. Life is scaled, and it's all functional movement. And so CrossFit has a big place for people, and that's why I like it. And that's why I still like to dabble in it from a movement perspective, that's where my business mind lives. That's where my anatomy mind lives, my biomechanics mind lives. And so CrossFit challenges me mentally when helping other people. That's another reason why I really like it. Right now, I'm doing just brute strength training 3 days a week, CrossFit a couple of days a week, and occasionally I'll get out on the bike for a long bike ride. That's where I'm at. Pulling the kids in a bike trailer.
Yeah, speaking of kids, so you are a father of two boys, 4 and 2, you said?
Yep, 2 and 4, Carter 2, Keller 4.
And I think it's really good to explain to people what you just said is, your goals have shifted based on other priorities. Not only do you own your own business, but you're a dad now of two boys. And as you said, it might shift back. Maybe your boys are more active, more individual based when they get older, and maybe you can have more time to do those things. Can you speak just a little bit? I know for Caden, it's almost like a trifecta. And what I mean by that is the importance of he's not only just a PT or studying to be a PT, but he's also a coach for CrossFit and he's an athlete of CrossFit. So it's one of those things where, as you stated, in the clinician side, the more the better. The more people that you see, that just is better for you. And I feel like for Caden, it's really helped him blossom in all three aspects. For sure. Doing all those things and understanding that when people come in with injuries, and this sounds bad and I think people take it the wrong way, but if he's had an injury himself and he's helped himself through it, he's seen more things. It's just made him a more well-rounded PT.
Oh, 100%. And I will tell you, this is part of the story that I share with everybody. So it's part of my messaging. It's part of my marketing. It's part of every interaction I have with a client, potential client, future client, past client. Is my story is that I had crippling back pain as a teen. Nobody could figure it out. I went to PT school and I was like, these dudes got my back. Help me out, fix me up. But they couldn't. They didn't know what the deal was. It was very atypical. It did not present like normal back pain. It was wild. I had a similar incident with my shoulder. And then in PT school, 8 weeks before my first clinical rotation, I had ACL, MCL, both meniscus blowout playing ball. So I rehabbed while in PT school, which was not, I was studying a lot and like doing some quad sets. That was my rehab. And I ended up with this ridiculous knee pain. I couldn't get out of a chair. I couldn't go upstairs, much less run or play ball. I had a different mindset. I was trying to just live. And so out of my own story, that is where I learned so much. What I used from PT school is like 3% maybe. You're going to learn more with interactions with people who have problems. You're going to learn more from your own problems, and that's why I feel it's so important to live in that space. So many PTs treat athletes but have never done what they do. It's a challenge. I see some, I don't know, there's T-shirts running around like, does your PT even squat? But it's a good point.
They should.
Yeah, it's a good point because they're trying to restore you to something that they don't understand, and I don't think it's possible. There's no way to bridge the gap between where you are and where you can't see, where you don't know. You have to know something about that, even just a little bit, to be able to bridge that gap. And you're exactly right. Your own injuries help you navigate that. Coaching people and watching people move in that space frequently and consistently help you navigate that and understand movement and how to help people. And that's a big factor that's missing in particularly the athlete space. High school kid gets injured on the field. They understand, like, okay, well, this guy's going to play football again. He needs to be able to run. He needs to be able to jump probably a little bit. He might have to push, a 300-pound dude in front of him. But when it comes to CrossFit, Olympic lifting, power lifting, these detailed, nuanced, biomechanical things that are happening with functional movement, it's way over the head. And I think that's the biggest disservice that in-network provides to the athlete, is a lack of understanding of what they really need and what their movement should look like. And for a new PT coming out, you're you're now starting to be able to see, like, yeah, I've learned this piece of the anatomy. I know this little bit about the biomechanics. I know how the shoulder is knit together. And now I'm seeing that functionally in people I'm coaching. And now that's you're right, it's a trifecta. Being able to make sense of somebody's movement is difficult if you don't know your anatomy, you don't know what good movement patterns look like, and you've never done it yourself.
Yeah. And coming out of school and even still being in school, there are things that even now I see that I'm learning in certain practice pattern courses where I'm like, okay, cool. I see the usefulness and the effectiveness of that, but I still feel like there's a disconnect where it's like, how do I really apply this to people? And I'm sensing some of that even with some of my classmates too. I mean, I've seen a couple of them be put in situations where they're actually presented with somebody in front of them, not in a school setting or a clinical setting. Someone's asking them a question. It's like, hey, can you help me? And they're just like, oh my gosh, like I don't have the doctor's script in front of me. I don't have my template laid out for how I'm going to approach examining the shoulder. Like it's just very flush. And it's because they don't have the experience of being out in the world and seeing those different things. But for you, coming out of that type of clinical atmosphere that you were in to start, what were some of the resources and other things that you went to find to try to help change your thinking a little bit when evaluating people?
Yeah, that's a good question. I mean, the world is packed full of continuing education. Where do you even begin? Does it ever stop? I'm to a point now where it's like, what am I going to take now that's going to help people in front of me? I've never been the type that I'm doing this to satisfy my hours. I'm looking for the next thing that's going to help somebody get back to where they need to be as soon as possible. And so that pushed me into a couple of different things, and each thing I've taken has opened my eyes to something new. And what you need to know about me, I'm a tinker. I love to tinker. All right. I mean, each patient is a new opportunity for me to do something a little different. Let's try this little thing. Patients don't know if you know what you're doing or not. They just assume you do because they're seeing you and they're paying you money to do it, or they're using, they're going to the in-network facility, whatever. Got an old saying, fake it till you make it. Your patients do not know if you know what you're doing or not. Now, do I know what I'm doing? Yes. But I will also sprinkle in a little bit of things that I'm just wondering about. Like, I wonder if I can do this and create change, over here, things like that. And some really good resources that I've used. I'm not getting paid by these people, but it's been pretty solid. One is dry needling. Not all dry needling is created equal. I'm a big fan of MyoPain. There are other good courses out there. But MyoPain really pushes safety. Their anatomical safety practices make more sense than some other stuff I've heard, and probably a close second to that's Kineticore. So dry needling was a boom. That opened up so many doors for me to treat referred pain. What we learned in school is if it was referred, it was the spine. We had a conversation about that just a couple days ago. And so that made a lot of things really difficult to fix as an early clinician. Like, dude, we're doing Williams flexion and you still have pain. What's the deal? Yeah. What's wrong with you, man? But after starting to target some of this muscular stuff, like, oh, now I understand. Like, hey, sciatica, which I personally don't believe exists anymore, and is just a garbage bag term. You have pain down your leg. You go to the doctor and you say, hey, I got pain down my leg. He says, oh, you got sciatica. Thanks, doc. That you just told me I had pain in my leg. You just used a different word. That's not helpful. But now I know, hey, trigger points through certain muscles in the hips can create the same pain. All the way down to the foot, numbness, tingling, burning, all the sensations nerves create, muscles can also create. So that was a big, big, big one. Another one was selective functional movement assessment. Both of you are familiar with Gray Cook? Yeah, Gray Cook. So that's the medical sister to the functional movement screen. And this was really my first experience into tying more together than just upstream, downstream, which is very popular for the DPT programs. Is, hey, if the knee's busted up, look at the hip, look at the ankle. And really, even diving into some of Starrett's stuff, Starrett's stuff, he's changed the game up significantly just in how people think about movement. And I think all PTs should be looking at that because it's valuable. And my home programs is Starrett's stuff. I mean, he really changed the way that clinicians in this type of arena can help people progress and mobilize and move differently on their own. Like the program, HEP.com, it's not going to fix your hip capsule, all right? And so this stuff that's been a big game changer. And I started getting into that on my way out of PT school. So that was really probably the first. Dry needling was the second. And that was very closely tied to the SFMA, which really started to tie in a lot of like anterior chain tissues that were long. And so that was my first kind of intro into the concept of like, hey, maybe this stuff is not just above and just below. Maybe this can get a little further away than we think. And that kind of sent me into the anatomy trained zone. And that was my most recent course, and it was legit. Man, it's been a game changer just in the last, I've been practicing for 8 years, and this stuff is still critically changing how I practice. And it really highlighted for me these planes of tissue that run from the top of your eyebrows and terminate in your plantar fascia. Mm-hmm. It's the real deal. Fascia when I was in school was kind of hokey. It was like, man, what are these teachers teaching us? What's craniosacral? What does that even mean? And but it's real, and there's lots of research behind it now that didn't exist then, just in the past 6 or 7 years. And so there are good resources out there, some far superior. I tend to pursue resources where I can take a concept and apply it to a patient, not take an exercise and give it to a patient. I want to take a concept and apply it to a patient, because then the sky's the limit. It's like if I understand the basic concepts of how a joint moves, I can do joint mobilizations however I want to. Mm-hmm. If I understand the basic way fascial planes run and where they should go, now I can take those concepts and push fascia wherever I want it to go. And as long as we can test, retest, mm-hmm. Hey, what do you move like? Move the fascia around. Is the movement better? Yes or no? Did you do something good? Yes or no? And so there are some, just brilliant people in the world. Those are the people I'm looking for. I don't want somebody teaching me Therex. I don't do Therex. We squat, we deadlift.
Do functional movements.
Yeah, we carry heavy stuff, Yeah. Now, is there a place for Therex? Absolutely. But as far as this arena, it's really the education that's out there. It really needs to be functional. How can you diagnose somebody from head to toe and understand how all of it knits together, how all of it functions as a unit to create functional movement, and how these things tie in when something is not quite right. Like I can't tell you how many shoulders I fixed manipulating the pelvis. I don't think I can even say manipulation. Mobilizing the pelvis. Gotta watch myself. I had a pitcher who, his arm was fine. This guy he'd been to rehab, and they crushed him with some band work. TheraBand. And his shoulder moved fine. It had great mobility. His T-spine was fine. His neck was fine. He had shoulder pain when he threw. It ended up being his left ankle. It was stuck, so when his body couldn't decelerate. His arm had to decelerate because his body couldn't rotate over the left ankle. And so, to me, that was the whammy. Like, yeah, you can't just evaluate a joint. You got to evaluate everything because everything matters. When we're talking about functional movement and functional movers, every single piece of the puzzle matters. And that's why all of my education I've really pushed towards functional, full body. How's the stuff work? How can I apply it?
Chad, I think for our listeners, just a little bit curious, we each have our own businesses. They're a little bit different, mm-hmm. but inside of every person's business, there's that scope of practice. And for me, I have a staff of 8 people. I don't know if you have a staff or not, but I guess my question for you is where does it start to get to a point where you maybe see more of a benefit of creating more of a network and having, whether it be partners or just people that you send people to? For me, when I first started my business, I wanted to know everything. I wanted to be the nutritionist, the Olympic coach, the gymnastics. I wanted all that stuff. And then I figured out wow, in order to create a better business and to have my business grow more, I can't be the person who just knows all. Now, I think it's important that I have some type of knowledge in every
Sure.
single thing, but it's about bringing in an expert or bringing in someone that really is just more efficient with my time. So can you just talk about maybe some people that you have in your network and kind of maybe who you send to where? Like, do you have a chiropractor? Do you have someone that, you know, you send people to and stuff like that?
Yeah, absolutely. I do have a chiro. So there's the blood feud, chiros versus PTs. It will always exist. The marketplace doesn't understand the difference or the value in either. I have one because I don't like to deal with acute spine stuff. I just don't. If somebody comes to me and they can't move because their back is so lit up, hey, go see Brett, Dr. Brett McPeak, Danville Chiropractic. I don't want to deal with it. Once he settles things down, come on back. We'll fix your movement, get you back on track. Good quote. Your network is your net worth. That's a good one. Yeah. There's endless value in somebody's network. I'm constantly trying to network with new people, new gyms, new coaches. Not only because that's valuable for my business, but I hope to add value to their business. Gyms that have broken members don't make money because gym members leave when they can't use their membership. So always trying to find who's next. The critical piece for me is trusted in the network. My network's pretty big, but the amount of people I'm going to send one of my people to is very small because you get 50% of the credit for a good referral and 100% of the blame for a bad one. And so I'm not going to just say, hey, I met you today. I like you. You're an Air Force man. I really like that. But I don't know you. You know what I mean? I couldn't rightfully send a patient to you just because I don't know you. A different CrossFit coach over on the west side that I've been dealing with for 2 years, it's a different story. And I can say, look, I know this guy. I trust him. He understands movement in a similar way I do. He understands how to modify and scale. And we've had a deep conversation about your problems that we can avoid when you go see this guy. And that's valuable for me. It's valuable for my patient, and it's valuable for the coach. And so those connections have to be made. And you're right. I've been in the same boat. I've been in the nutrition space. I've been in the strength and conditioning space. I am in the PT space. There is no value in being the jack of all trades. You have to be the master of one. And you do need to have a knowledge of some other stuff. Things that you don't know about, you need to have a resource to send them to. Because really, at the end of the day, you already mentioned it, it's being efficient with your time, but what about your client's time? I'm not trying to waste my client's time. I'm certainly not trying to waste their money. And so being able to create a network, which in my opinion should be very small and tight-knit, has infinite value, not just for the business, but more for the human being in front of you. And that's where it has the most impact. I'm not super concerned about me. I can go find another 15 CrossFit coaches in the next month if I want to. But who's going to serve my client the best? You know, who's going to take them? Who's going to go the extra mile? Who's going to add value to my patient that I can't? I'm not ever going to send somebody for a second if I don't think they're not going to go above and beyond. And so that's the critical piece in my business of creating the network is who can I get to know in a way that's going to add value to my patient. Does it add value to me? Maybe. Maybe not. I don't care. I want it to add value to that person that's trusting me with their physical health. Now who can I entrust that to somebody else?
That's when it becomes like patient-centered care.
Yeah.
Which for some people, I don't think they are on that train. It's not as much about the patient as much as it is about themselves, their ego, and what they can get out of it. And I like that you talk about how you select the people that are within your network based on what you feel is best for the patient and not even necessarily what's best for yourself. And we actually talked about that a little bit in our last episode in our podcast about relationships and how you should be each giving 100% of yourselves to the relationship so that you both are benefiting equally. And thankfully, our relationship within M4G is very positive, and I think we have a good communication skill around, like how are we treating specific athletes? How do we need to communicate about injuries that they might have and how we're going to scale things in their classes and putting some of that responsibility on the athletes as well. But what advice would you give to maybe some new clinicians who are listening to this and might be thinking, wow, I might want to do my own thing and do it within that sort of gym facility sort of approach. But they might be thinking like, man, the place that I'm at, I mean, the head coach or multiple of the coaches, they don't seem as receptive to what it is that I want to try to create. So how do you approach those sort of relationship building things?
That's tough. I mean, in a world, it's an economic planet. Everybody's out for themselves. I am out for money, all of it. Okay, it's a business. I got to feed my kids. I want to create a life for my family that no one else can. The only way you do that is with money. And everybody understands that. And so you have to get way, way beyond money. You have to be able to communicate value to somebody, and that is something that has disappeared from the marketplace. Clinicians go out and they do patient-centered care because they work at a big facility that says we do patient-centered care. But what that person doesn't have is their own personal brand. They can't provide value past what the insurance provides. Okay, insurance reimburses a clinic $120. The patient paid a $50 copay, and they're getting $30 of value. And in that setting, you can't go beyond that. Same thing in a CrossFit gym. These guys are already doing functional movement. They already know the scales. They've already known people who have gone to PT, not gotten better because they're basically just doing low-grade strength and conditioning. They say you're weak and therefore you have pain, and that doesn't exist. That is a phenomenon that does not exist. And so what happens is it's hard to create that environment when, and really the strength coaches are not wrong. Like you can look up on YouTube what PTs are doing. It's not hard. It requires no doctorate or $100,000 in debt, or in my case, 300. And so that is where you really have to communicate your value. And if you don't have your own brand, so this is to answer your question. What if new clinicians are thinking like, man, this is something I'd like to do. How do I do it? What do I do to get there? You have to have your own brand. Your brand has to be tied to something beyond money. If money is what your brand is about, you will never communicate value beyond a dollar amount. It's impossible. My brand, for instance, I'll be upfront with you. I want money. I mean, let's say 10 years from now, I want to buy a jet. Am I going to own a jet? I don't know. I want one. But it takes money. You know what I mean? We live in an economic planet. Why would we not talk about money? Everybody needs it. People will spoon you at night when you say you're broke and don't have anything, but people cast you to the curb if you want to talk about money. But you have to be able to communicate your value so far beyond money. You have to be able to justify what you do at double the cost, and people are still getting a deal. And if you can't do that, you don't even need to attempt it. So for a new clinician, I would say it's really difficult. Like, not a lot of people are in your position. They're not doing CrossFit, coaching CrossFit, and going to PT school. So you've got a leg up on how many of your classmates? Just because of the world.
Quite a few, I think.
Yeah, just because of the world. You've thrown yourself into that world. That gives you a huge advantage. To come out and in any sector of PT and think, I want to do this on my own with nothing but clinical rotations, you don't even know who you are yet. If your vision is just to make money, go make it. But money has to have a reason to flow to you. And if you don't have that and you can't convey that message to somebody, it won't. I want to change healthcare. I want to do cash PT, but I want to use that to facilitate a change in healthcare where people aren't getting an image when they walk out of the primary care their first visit, right? People are having way too many MRIs. People are going places and getting told they need surgery and they've not done PT yet. Or they haven't done any other conservative management yet. And they've had pain for 6 months on meds and maybe some rest, but the doctor just doesn't know what to do. It's like, I don't know what to do. What's the word? An exploratory surgery. Let's explore.
Let's just do surgery to see if we can find out what's going on.
Yeah, let's see what's going on in there. Your image didn't show anything, so let's see what's going on in there. Yeah, and so you won't talk to anybody who says healthcare is perfect. Mm-hmm. Everybody knows it's broken. There are certain things that are broken within physical therapy the way clinicians operate. There are certain things that are broken within physical therapy and how it interfaces with pre-physical therapy and post-physical therapy. And that's my mission. I could care less about just doing PT to be a PT. If I go back now, knowing what I know now, I would have probably not gone to college. I'd have a massive real estate portfolio by now and forgotten the rest. But this is the best way I have right now to make money, and I'm passionate about the problems, and that's where businesses come from. Businesses form out of a problem. Mm-hmm. Your area needed a CrossFit gym. Boom. M4G.
Give them a solution to that problem.
Yeah. If you find yourself consistently complaining about something, there's your business. Go figure out how to fix it. Create a solution. Tell the world. But for a new clinician, you got to be your own brand. You got to have a mission that extends beyond money, and you have to know everything about that space.
Find that thing that you're like really passionate about and turn that into your deal. I think a lot of people, and I think where I'm going with this is a lot of young clinicians, especially coming out of graduate school, still don't know what they're passionate about.
Yeah.
And that gets them into this like, oh, well, maybe I should just take this job so I can figure it out, or go to this residency so I can figure it out. And so maybe that's their path. That's how they figure out what it is that they're passionate about. But then what you're saying is once you find that, that's the thing that you need to focus on and not be so generalized, because we've got too many generalized practitioners out there not really making a dent.
Yeah, 100%. And that was me. I'm only now really figuring out what I'm about. And I had to spend 5 years in corporate rehab to figure it out. I mean, I spent 5 years learning and understanding the flaws with how the system works. I spent 5 years learning and understanding how I can't get this patient better because I have 3 other patients right over here. I can't get this patient better because insurance won't pay for it. I spent 3 years dealing with the mental havoc of knowing I can do more but don't have the time or don't have the resources, or dealing with unethical problems, or not unethical problems, ethical problems, like hiding dry needling billing inside of a Medicare patient's chart. Medicare doesn't pay for it. Just sneak it in there. Call it something else. Man, that wrecked me in my brain. But, I mean, I had to see so many patients a day. I had to bill so many units per patient. So what do? You comply with the system until you get tired of it, and then you start your own practice.
Caden, do you remember your original question to Chad?
No. Did I dodge it?
Okay. Well, no, I was actually going to make you the interviewer now. So could you answer that question? Basically asking him, what would you tell a new clinician? Can you take us back to when you first stepped foot in M4G and just the whole thought process that you went through? And he made a great point. You're I don't know your classmates, but I would assume you're farther along than 90% of them. What's gotten you to that point, and just what was your whole mindset once you stepped foot till now?
Yeah, I'll preface that by saying that farther along has a different meaning depending on what you're looking at. So
throwing his classmates
from an educational standpoint, maybe not. I'm not the best student. I wouldn't even pretend that I am. I don't get the best grades. I get enough to get through. I do what I need to do. From a practical standpoint, I personally feel like I have a little bit more experience having been an athletic trainer for as many years as I have been, working with athletes, being in the sphere that I'm passionate about. And so I got to a point, we'll kind of go back. We'll do story time a little bit.
I love story time.
It was like, and I don't even know if I've shared this with either of you. I might have. But I think it was the end of the first semester of PT school. And I'm like going through some of this stuff, and I'm trying to get through the classes like everyone else, and I'm struggling a little bit. And I'm just like, is this really for me? This doesn't feel like what it is that I'm actually passionate about. And I had actually gone to a clinic that's run by athletic trainers in Indianapolis, and I watched them do what they were doing, and I was like, this is a lot more fun than what I'm seeing in physical therapy. So I gave that next spring semester another round, went through my summer clinical, kind of gathered that passion a little bit, but I had just found M4G in like April of 19 and just fell in love with the community. Again, I was able to finally start going to a CrossFit gym. I'd been going to NIFS downtown, not being able to do CrossFit the way that I want. And I just had this light bulb moment where I was like, what if I did what those people were doing, but did it as a physical therapist in this space around these people. And so I started getting into the research. I'm looking at people, like Kelly Starrett, Danny Mattei, Aaron LeBauer, all these people that run cash practices out of gyms and build those relationships with people. And so for me, like, that's the moment that for me, I found that passion, and I was able to, like you said earlier, that trifecta of being a coach. I'd started being a coach around that time, became a new member, and then had this fire lit underneath of me for developing a business that's going to be able to help people in a way that I didn't previously think was possible in the current system. So that's kind of what got me to where I am. And so if I'm giving advice to either people that are my age now, third year DPT students, or second year, first year, or even people considering physical therapy, think about the thing that you're passionate about. Really take that to heart first before you start, and realize that if it is in line with physical therapy, it doesn't have to be exactly what they teach you in school. School is the only way to get there, because you have to purchase the ticket to get on the train so you can get to the island where you get to do what you want. But find those things that you're passionate about and then move with that. So I guess that's what I got to say.
And your passions might change. Just like my passions for my own physical health have changed over the last year, my passion for what I'm doing has changed over the last year. When I came out of school, I thought I was going to make the money. Big dog, paying off that debt. Whammy. Not making any money. And so immediately then I was like, all right, well, here we are. I've got this DPT. Me and my wife are loaded with grad school debt. What do I want to be doing? Because I'm not gonna do home health just to make more money to pay off my debt, because I hate home health. Mm-hmm. Now, if you enjoy home health, that's a great place to go. And if you just want to knock out some debt and then move on with some different area, home health is a great way to do it. I mean, I know lots of people who just said, I'm going to buckle down, I'm going to crush home health, get my debt out of here as fast as possible, and then we're going to see what's out there. What do I want to be doing? There's nothing wrong with that. Mm-mm. For me, we couldn't afford the standard repayment. I mean, we'd have been living in a cardboard box with no kids for the next 20 years. And so for me, my passion became athletes. I was always a ball player. I was always a golfer. At that time, I didn't understand movement the way I do now, but I understood it more than all the other clinicians I was working with. Even as a student, my first what are they called? Clinical instructors. Mm-hmm. My first one, he said, I'm not going to teach you anything. Just go do what you want. That's what he said to me. I was like, all right, man, let's figure this out.
I need that.
Yeah. I mean, it was wild. It was my first rotation ever.
Yeah.
I mean, he said, hey, show me your joint mobilization. I was like, all right. He was like, you good, man? It's like, see you in 8 weeks. I'm not going to teach you anything. I was like, all right, whatever. So right then, it was like thrown to the wolves, thrown in the fire. I took patience. I did what I wanted. I figured a lot of stuff out that first go-round. And by the time I was working my first job, I had been on so many ortho rotations. I'm crushing supple leopard, just trying to do some different stuff than what I'm seeing, and it's different. I mean, I provided a different service as a brand new grad than anybody else I worked with. And that extended every place I went. I worked at 3 different places before I started my clinical practice, and it was just different. The clients I attracted in were different. The amount of visits I had to see them were different. The outcomes I was getting were different. The tools I was using were different. The amount of pain that I was giving people was different. That's another thing I will recommend to new clinicians. Don't be afraid to hurt people. If you know what you're doing, hurt them for their own good. Mm-hmm. Everybody's going to squeal. If you're not making them squeal, they're not going to get better any faster. Yeah. So I hurt people for a living. They still keep coming back.
Yeah.
So, yeah.
I got a 2-parter. I think we'll see if I can put this together. So I'm interested in learning a little bit more about your specific mission with the healthcare side of things, and then once you're done with that, can you tie that back into why the benefit of what you're trying to do with that is useful for all types of athletes, and why that's going to be beneficial, especially for people that do functional fitness? Because I feel like functional fitness people, specifically CrossFitters, because the name means something to physicians and other practitioners, when they say they get hurt doing CrossFit, people are immediately slapping that CrossFit's dangerous sticker on it and telling them they should stop. So I want to hear how that healthcare shift trickles down into the benefit to CrossFit athletes and other strength athletes too.
Oh, sure. Yeah. So honestly, I love treating athletes. I probably won't ever treat a non-athlete again if I don't have to. The problem is with healthcare, the athlete population is so small. But the athlete population provides the biggest opportunity for me, which is these are the group of people who they continually struggle with pain because they get meds and rest and it doesn't work, and they continue CrossFit in the exact same way that they have been doing. And then, maybe they go see a specialist and they get a different local diagnosis for a shoulder or a knee or whatever, and they get maybe a stronger drug, maybe recommend rest, maybe some PT. The PT doesn't understand CrossFit or what the loading capacity required is for a CrossFit athlete, and so they don't get better. The other problem is there's no relationship between the PT and the CrossFit coach. And so how does the CrossFit coach know, like, what scale is the right scale? When obviously you could just trial and error back things all the way down to nothing. And in reality, like when a CrossFitter gets injured, they need to go strict on everything. They need to take speed totally out of the equation. And so what happens is CrossFitters, the active adult, the athlete, the fitness enthusiast, these are the people that are on the downhill slide to surgery. As soon as somebody sees a picture of their insides as an athlete, they're done. You might as well just sign them up and get it done. Because now their mindset is, I have torn anatomy. How am I going to CrossFit, Olympic lift, fitness enthuse with broken anatomy? The body always fills in the gap. It'll heal itself if you do it right. If you understand, like, hey, look, here are your limitations, here are your boundaries. We cannot move or load beyond your boundaries for X amount of time, and then when we get there, now we can start chipping away at your capacity again, building you back up. And so these are the people that give me the opportunity to collect data. Like, look, hey, I've prevented X amount of surgeries in the last 12 months, hips, knees, shoulders. I've done it. So our mutual running contact scheduled for surgery on her hip the week after I met her. We hammered 2 or 3 sessions out that week, no surgery, still going strong, still doing good. Now, it's not to say she won't need it eventually. It's not to say when I see somebody, they're never going to need surgery, because they might. Broken anatomy needs repaired. I mean, there's no way around that sometimes, but let's say shoulder guy has stiff mid-back, ribs that don't move, has a really tight joint capsule and is missing full range of motion, no external rotation, can't even think about front rack position, and a tear in his rotator cuff. How do we know that the rotator cuff is the cause of the pain when he's got 6 other things that are preventing him from moving well? And the problem is not CrossFit. There's no bad movement. There's only bad movers. People don't get hurt doing CrossFit. They get hurt sitting in their chair for 23 hours and sleeping in fetal position and driving their cars all day and then attempting 60 minutes of CrossFit. That's the problem. It's not, CrossFit has nothing to do with it. The programming has nothing to do with it. It's the fact that people spend so much of their day in positions that are not conducive to CrossFit, and so CrossFit wrecks them because it puts their body in positions that they don't have. So I'm using this to springboard actually into the business-to-business space where companies are getting raked over the coals with insurance premiums, spending hundreds of thousands of dollars on workers' comp claims for surgeries that people probably don't need, and take my business into a big sector. That's the only way I'm going to get to my mission, and I know that. My passion is with athletes, treating them, restoring them back to whatever they want to be doing. But at the end of the day, for me to get to my mission, I have to go big. I have to go wide. I have to go business. And so that's how I'm doing it. But, talking about how does this trickle down into the athlete, it's when I was mentioning how the athlete gets managed is the critical piece, and they're just mismanaged. That's the deal. They get images too early. They get meds. The doctor has no, and I'm not hammering on doctors. Doctors, a CrossFit doctor is light years ahead of family care doc who's 70. CrossFit didn't even exist when this guy lasted a bench press. And so you're going to have different mindsets around things from different individuals. There's an excellent shoulder doc in Indy, Dr. Badman. I've seen surgeries from 15 docs. He is light years ahead. He does CrossFit. He understands CrossFit. The drawback is when they can't observe somebody's movement. The way people move is the problem. It's not the anatomy is not the problem. Something that's torn is not the problem. The way people move is the problem. And the way people move is a reflection of the way they live their life. And so this has to eventually trickle down into athletes through better protocols when they enter in. How do they get managed from start to finish? Do they get meds and rest? Is that okay? Yes. Does it solve the problem? No. It's a Band-Aid. But it does at least tell you, hey, their pain can go away. It's an inflammatory process, can be improved with an anti-inflammatory. And so there's value in everything. But really what has to happen is when a CrossFitter goes to the doctor, they need to have in their mindset, in their mind, I have movement problems. Like how can this doc help me, back my pain down, understanding I have movement problems. That's the benefit of coaches. That's the benefit of PTs in the gym is you can tell them over and over and over, you have movement problems. And all CrossFitters do. Nobody moves perfect. We are in pursuit of perfection in movement and nothing else. Nobody's ever going to be perfect. Rich Froning wasn't perfect. You can see some janky positions when he jerks his elbows all cranked out to the side, but he's a freak. Doesn't mean you can't be strong. Doesn't mean you can't be the fittest man on earth. It doesn't mean you can't overcome your problems. But if you've got one, you got to understand you're in control. The problem with athletes and humans in general, they give away all the control. They go to the doc's in control. They go to the surgeon's in control. And they forget about all the things that they have control over that can improve their condition, but nobody ever walks them through it. Hey, look, your nutrition sucks. Hey, look, you drink too much. Hey, look, you don't sleep ever. Just those three things right there could solve a lot of people's problems, but nobody's addressing it at any level. The only people who are addressing nutrition are nutritionists, and nutrition is probably the solution to most Americans' problems, except dorsiflexion. I don't know how nutrition fits into
eat
ankle.
Enough grapes to fix that.
I don't know if you can eat enough to fix your dorsiflexion, but it's the lifestyle components that nobody addresses. People give away control to the expert, and ultimately rob themselves of their potential to get better because nobody is telling them, here's how you take control of yourself here. Here's how we modify. Here's how we scale. Here's how we maintain your fitness levels. Here's how we maintain your capacity while maintaining movement within certain boundaries. And that's what I hope happens over the course of time is, one, you're going to see cash practices pop up everywhere. Insurance reimbursements down every year. Medicare first, and then everybody follows Medicare. 5 years from now, they're doing 9% next year, 9% decrease. 5 years from now, in-network clinics are going to have to add cash services. They're going to have to sell physical products. They're going to have to do something to supplement. That's why they're high volume, is because reimbursement's going down. And so with the cash practice boom, there's going to be an increase in ability for people to go the extra mile for the athlete. Say, now we can talk about your nutrition. We can spend an hour. Like, if you came to see me, I could spend an hour talking about nutrition because you're paying me for it. Mm-hmm. And it's valuable. And it's going to improve your life. It's going to improve your health. It's going to improve your pain. We could talk about your sleep problems. We can diagnose your movement problems. I can watch you squat under load in my clinic because I have the tools for that. And that's where this is going to trickle down to is, as the system improves, as cash practices pop up, things are going to start looking a little different. And like, you got the knowledge, you got the skills to change somebody's life right now.
Yeah.
You have the knowledge in your space to change somebody's life right now. How many fitness transformations have you seen this year? Yeah.
Quite a few. I would say 40% of our athletes have just seen like crazy lifetime type changes for sure.
Yeah. And they're paying you money to do it. And you provide them that value and beyond. And that's the problem within network is They can't provide that value. They can't bill for a nutrition consult. They can't bill for spending 20 minutes talking about how you drink too much and that's why you don't sleep very good. And as cash practices pop up, nobody's starting a cash practice that nobody's going to survive in cash practice who doesn't have the knowledge and skills to do it. And all those knowledge and skills come along with those components. Not being a master of the component, but understanding that those components are real. Nutrition's real, sleep's real, stress is real, how you move is real, how you spend your day is real. I think I put up a post the other day. I told myself this like 50 times in the last week. Now I can't remember what I said. But symptoms are solved at the anatomy and biomechanics level. Mm-hmm. Problems are solved at the lifestyle and habit level. And that's the truth.
Yeah. And one of our core values at the gym is empowerment.
Yeah.
And I think that's a huge thing for people. And that's something that we recognize is giving people the tools to be able to do more things themselves and not have to rely on us or other people to fix things for them. It's giving them the empowerment to be like, yeah, I learned some stuff when I was with them. They gave me some things that I can use in my lifestyle moving forward to make life a little bit easier. And nutrition is definitely one of those things that I've thrown into my question asking when I talk to people about stuff. I talk about their sleep, talk about their stress, because those are definitely things that are within that lifestyle component that can have an effect on your ability to recover and your ability to move, all those sorts of things. One last topic based on what you were just telling us a little bit is for some people, they might not understand what we're referring to when it's, in network versus cash, and how does that benefit either one or the other based on, what type of insurance they might have, how they go about paying for healthcare, their relationship with healthcare, viewing it as, is this just a service or is this something that's an investment for my life? Those sorts of things. Can you fill us in on sort of that stuff?
Yeah, insurance for me is maybe my biggest soapbox, in that it blows my mind. People spend so much money on a service that can't add value because you pay your premiums, you go to the clinic, but you don't know who you're going to get. You might get brand new clinician, you might get a 70-year-old clinician, you just don't know. And so when we talk about in-network versus out-of-network, it's can you use your insurance or are you paying your own money? And there are some who play in the out-of-network game where you're going to spend your cash, you're going to meet your out-of-network deductible, and then insurance is going to pick some stuff up. So there's a little bit of a hybrid there. Ultimately, the factor is, do you want to pay for the service you're getting and have a service give you value beyond what you pay, or do you just want to use your insurance? That's my biggest struggle. The insurance model it lives in its own space. Like, people think cash is expensive. Cash pay rehab is expensive. And yeah, sure, what's expensive? I mean, what's expensive to you? How much money is a lot of money?
$1,000.
Okay, $1,000 can't fix anybody's problem in the entire world. The guy who lives in Africa with no shoes, $1,000 cannot solve his problem. It's just not a lot of money. The person who tells you $1,000 is a lot of money drives a $70,000 F-250. So it's the mindset around insurance that gets people so hung up, because people obviously spend way more money on other things like a car. I mean, car A cost $5,000 and car B costs $100,000, and they both get you from A to B in the same way. And so it's where people perceive the value, and that's what the most difficult thing is it not people are choosing insurance over cash. It's they don't understand the value of cash versus insurance, because at the end of the day, the cost difference is not that much. I mean, let's say my middle of the road package is $3,000. And now this is for a very specific type of person. This is for the person who's been through the muck of healthcare, has not gotten better, and they're ready to make something happen. Let's do it. But that $3,000 is the same $3,000 you're going to spend going to in-network clinic for 3 times as long, 3 times as many times a week, plus you're probably taking off work, doing something crazy, losing money to go spend your money. And that's what their deductible is. You got a $3,000 deductible on January 1. Most people have their surgeries at the end of the year because their deductible's met. They still, and then they start January 1 at PT and they spend $2,000 on their deductible. Now, personally, I would rather spend $2,000 on somebody that's going to get my whole self well in this amount of time than spend that going somewhere where I don't know what I'm getting. Like the in-network clinician can't, they're not selling anything. People are just coming in. It's an easy close. The patient comes in and says, I want to sign up. Okay, you'll be with Joe. Joe's got an opening tomorrow. See you then. I mean, so the person doesn't get to choose who they're seeing. How does that person know? Does this person know what they're doing? Or are they brand new? Have they been around for a while? Can they help my specific case better than the next guy? And so really it just needs to be a large educational piece around not the difference in insurance versus cash and the cost, because on most levels, they're the same. Sometimes cash is even cheaper. Consider the $2,000 deductible. I'll see somebody 6 times for $1,100, and they're better in half the time. They spent half their deductible instead of all of it. They got way better in a shorter amount of time. So it's not always about money. It's just around people just don't understand the difference between spending money over here, spending money over here.
The value of where you're putting your money, what you're getting for it.
Yeah, I mean, that's one of those deals like, I want to put all my eggs in the one basket that I know is a guarantee. Mm-hmm. You know what I mean? You'll hear a lot about diversification, which is great. Diversification means you got to hire somebody to put your stuff all over the place and maybe make some money. I want to put all my eggs in the one basket that I know is going to get me right, make me some money. And that's the deal. And that always goes back to that piece. What's your brand? What's your value? Can you communicate that value to somebody? If you couldn't communicate the value of M4G, you wouldn't have any members. So you have figured out how to communicate your value over some other place's value. Are there other gyms close by? Probably within a couple of miles. You got Planet Fitness. What's your value over Planet Fitness?
Yeah, well, it almost sounds like, that's the relationship. Same thing with PT is almost gyms. We'll just call them gyms.
Yeah.
If Lifetime Fitness is, I don't even know what their membership, $50, $60 a month, as opposed to whatever ours is, $150. It's helping people understand that, yes, clearly this one costs more, but it's exactly what we talk about all the time. What do you value?
Sure. What
do you get out of that? For CrossFit, it's becoming more and more and more and more about the community aspect.
Yeah,
we're not just helping you lose weight or teaching you better health habits. It's about actually giving you some lifetime friends. It's about people. We're really starting to go down this road with a friend of ours who's now a coach. Mental health. Oh, yeah. Mental health is a huge thing right now, especially at our gym. And talking about medicine and all those things, just having people who can understand what you're going through and understand what it is that they can maybe better hold you accountable to, and those kinds of things. And then almost creating, definitely not cliques, but like groups and friends and stuff like that of people who have lost a loved one due to suicide or depression or, those different kinds of things. So yeah, it's exactly as you said, you can't really put a value on it, because every single person's looking for something completely different.
Yeah, so. Absolutely. And if you don't communicate that value, how is that person going to know that you're what they need? Everybody's looking for something different. But there are a lot of people who are looking for what you provide. And if you fail to communicate that, they're going to go somewhere else and get underserved.
Yeah. And I like the choice aspect that you gave in that analogy too. It's like we want to be able to give patients the choice of seeing that this is the thing that has the most value and that's the one that I want to choose to go do. It's almost like somebody gets on CrossFit.com and they type in the search bar like, I want to do CrossFit near me. And it just automatically tells you, all right, you're going to go to this gym. Mm-hmm. And that's where you have to go. That's where you have to spend your money. And you don't get a chance to evaluate who's there, who's the coach, what's the community like, any of those sorts of things. It kind of takes that away from them. Yeah. So I really like that.
They gave away the control to the World Wide Web.
Yeah.
Yep.
And formerly Greg Glassman. Yeah. Peace out, bro.
Yeah. Later, dog. Yeah. No, but you're right, though. And that's been an interesting thing for me to see is – your message can always be improved. Your pitch can always be improved. What you are communicating to people can always be improved. And as I have improved that and expanded my network, I draw people from the deep south side, the far east side, the north side. Are there other cash PTs up there? Yeah, definitely. But people are coming to see me from crazy places. I'm like, what are you doing driving 50 minutes over here, man? But I like it. I'm not going to turn them away because
the message works.
Yeah, but the thing is, when you convey a message and somebody buys into that, they're already 50% better.
Yeah.
They're already thinking, hey, I'm going to get better because this. I believe this. I believe this. Beliefs are just decisions. If you can't say they're not. What you believe is a decision you've made. And if you make a new decision that you're going to get better, your brain will start making you get better. Your brain is the best search engine on earth, and it will constantly produce results for you based on what you believe. If you believe you're a piece of crap and your life is going nowhere, your brain will constantly give you evidence of that. If you've been to XYZ provider, XYZ PT, XYZ Chiro, and you haven't gotten better, your search engine is probably not great. It's probably telling you, yeah, you're not going to get better. You're hopeless. You got to have a message that busts through people's hopelessness. You got to have a message that busts through people's problem. Not the problem they think they have, that magic problem that they don't even know they have, which sometimes is the mindset. And I spend more visits deconstructing people's mindset around what they think about their body and what they think about what their image told them and what they think about all their failed courses of treatment so far. And once you can get somebody just to make a new decision, like, hey, this is it. I've got a clear path that we're going to follow, and we're going to get better. That's the deal. I mean, the mental health piece, and talking about mental health, I mean, it's kind of a rabbit off of mental health, but that's the deal. Like, what people's mindsets are is what they are. The way people live their life is what their mind is. And if you have a message and a value and you can communicate something to that person that can help them make a new decision, that's powerful.
Love it. Awesome. I want to finish the episode with your top 3 bang for your buck pieces of advice for people as far as like, this is a great mobility tool. This is a great resource. These are 3 things that I find that if I tell you, it's going to be of value to you.
All right. For the general public, for business, what's just general public? Anything?
Yep.
Anything. Okay. For business owners, follow up until you die or they die or until you get something on the calendar. Do not waver from it. It will pay off. I've seen it many times. Awesome. That's probably the best piece of advice that I can give for somebody aspiring to start their own business, create leads, make something happen. Every week, do it. They tell you, don't call me back. Say, I can't do that because I believe what I have is what you need. I'll call you next week. And do it. Set a reminder. Until you die or they die or you make something happen. My favorite tool by far is the Trigger Point Universal Roller. It's a bigger version of a peanut. I take it everywhere I go. If I'm in the car, it goes with me. If I'm in the car for a long time, it goes with me. If I'm on the plane, it goes with me. If we travel long distance, it goes with me. You can bust every piece of tissue with it, plus hit the T-spine, plus get like up into your fascia, all up in your diaphragm. It's a good tool. And then probably my third, those are the 2.
Any great book recommendations?
Oh, dang. Now we're getting...
You can answer that too, but maybe something family or personal like that you would say after owning a business now and stuff like that.
Yeah. That has by far been the biggest challenge. Starting a business, having kids, building a house, getting fired from my part-time job. That was something. Yeah. You heard the term burn the ships?
Yeah.
Yeah, I didn't burn my ship, but it burned down anyway. So that was a good one. Yeah, I think I wish I would have done a better job of understanding where my wife was in all this, communicating what my passions were and my dreams were, what my mission was, and doing a better job of getting our family on the same page before I started, because that has created some rifts. It's a challenge. And it, business is a different deal. I mean, you got to have a different mindset. You got to have a different type of hustle to do it. And managing that with a growing family is already difficult. And when you're not on the same page, that can create some real challenges. And so personally for me, I should have been a better leader in that sense. And so I would say if you got dreams, like you got a girlfriend, you want to get married, and you got dreams, you better make them known. Yeah, get that kick in the pants, Kate.
Tristan kicked me right in the pants.
Yeah, I really wish I would have done a better job at that, because I feel like my business could be further along had I done that. Having been on the same page as my wife, having her on the same page as me, or at least understanding the page I'm on, and where I want this book to go, how I want this book to finish. That was a good question, man. That weighs on me a lot. It really does. That's something I really wish I would have got handled earlier on, because it's created some stress in the marriage. It's created some stress in the family. I've built my business to where it is on like 40 or 45 hours a week. And I feel like, man, if I put this thing into overdrive, I could crank it. You know what I mean? But I know that's not necessarily best for home. It's not necessarily what's best for the kids. But I also feel like I can't do that in part because I didn't set the tone out of the gate. I kind of just took off. We didn't have too many conversations about it, and I regret that. It's created some difficult conversations on the tail end with what could have been a difficult conversation once on the front end. Luckily, she tolerates me. And things are looking up. Getting fired was the best thing that ever happened to me. So, yeah, you want to pick up 20 hours of extra time during the week, get your butt fired from your part-time job.
Don't give Tristan any ideas. I can't afford to be fired right now.
Don't fire Kate. Whatever you take out of this message, don't fire Kate. Best books. Dude, this one. I can get juiced up about some books these days. Extreme Ownership was phenomenal. Atomic Habits, phenomenal. Have you read that? Yeah. I mean, you can extend that into your life, your clients' lives. I mean, you can create some real change if you really dig into that and push that onto some people. But I will tell you, my favorite two books, I've pretty much given up on new books because I'm just going to roll these on audiobook over and over and over and over and over. It is 10X Rule by Grant Cardone and Be Obsessed or Be Average. I've listened to that one 4 times. I'm on number 5 right now. I listened to it on the way over. I'll listen to it on the way home. I'm telling you, man. Grant Cardone he's a sales dude. He's got like 8,000 real estate units. He's a brilliant dude, but he's inspirational. I mean, family dude, good dude, but he's fun to listen to. I mean, his books are packed full of useful information for business, for life, for family. His start was crazy. I mean, he was a drug addict, lost his dad at 10. I mean, going nowhere, druggie all the way through college, went to rehab, and they told him he's always going to be a druggie. His start was like something you wouldn't even believe. Like, I feel like my start, what am I even doing? Like, I need to have a drug problem. I need to hit rock bottom. Let's go. But, I mean, I don't think I'll ever listen to another book again. And he reads them, so he's ripping it. I mean, he's off on tangents. He's fun to listen to, very inspirational. And from a business standpoint, you want to get motivated, he's your guy.
That's awesome.
Yep.
Thank you, Chad. That was an awesome conversation.
Appreciate it.
We loved having you. One last thing before we sign off. I want to thank our sponsor, LRX Apparel. LRX Apparel, their purpose and their goal is to help make people better versions of themselves. So if you want to jump on that, go and head over to lrxapparel.com and use code LIVEPRESCRIBE to get 15% off your next order. Give them some love and show them that it's from us. So thank you guys for listening. Please, if you want to, give us a 5-star rating on iTunes, and we will catch you in the next one.